There are the 9 areas, but in that 9 area, first we try to select the central area. The central area of the lobe to be known as a central area of the lobe to be known as a this to be known as a eye system. So especially the auricular related, that means the ocular related disorders or the ophthalmic related conditions or the vision related disorders can be treatable by activating this point. So now easily you punctured. So remember, 0.1 to 2 mm needle should be inserted on the ear, but not more than 0.2 mm. So 2 mm means only you can see this entered is only this is 0.2. Yes, 1 to 2, 0.1 to 0.2 mm, but you touch and then feel here, but needle is not passed on the outside. Make sure that shouldn't pass on the other side. Even whatever you needle apply on the auricular, that goes other side also, but that's the wrong practice. So that's the reason you just apply the needle. So only 0.1 to 0.2 mm needle only advisable. Yeah, regular needles 0.5 tune, that means is the 13 into 25 mm needles called as a half tune, that you can use it, or you want it to use as a micro needle, but this is called as a micro needle or the sujok needles, but you can use as a sujok needle as well. For example, sujok needle, I wanted to use the superior to this region. That means is the first is the eye system, the middle one, the upper directly above to the eye system to be known as a tongue. So you just apply this needle 0.5 tune, half micro needle I just use it 0.2 mm I just applied on the tongue region to treat for the aphasia or maybe stammering, other tongue related disorders. We just use it. This always is good. Hopefully you understand. The first point is a central point. You recognize the central point will be good. Central point to be known as a eye point, the superior to that point to be known as a tongue point. Now just I see the middle point is the eye, below the eye point to be known as a tonsils. So any kind of the tonsils especially you wanted to treat, so you just apply this point will be the tonsils can be treatable. That means is the palatal tonsils. The tonsils also numerous types, in that is the palatal tonsils where you can see that bilaterally it is existing on the parallel, that's called as a tonsils, also known as a pharynx. When the pharynx get enlargement, that causes some kind of the swelling, so that can be treatable by activating this point. So hopefully you understand. The second is the one line is completed. Now we'll proceed for the top, the medial side. Now towards the face, tongue is connected to the upper part below the intertragic notch. Now we will see the first point to be known as a tooth related disorders. The first point to be known as a tooth extraction. The second point, that means the third area to be treatable. Remember, now 2 points I just applied this region. This point is treatable for the tooth related, jaw related disorders. Whatever the pain is there on the tooth related condition, just as a supplementary point, but I cannot tell you that all the tooth related or maybe all the teeth related problem can be treatable by activating this point as a supplementary point. By the way, because of the tooth pain, they will get the trigeminal neuralgia pain sometimes, or the temporomandibular joint related disorders. That particular time we just apply some of the points where exactly this tooth extraction, but this also to be known as a anesthetic point as well. For the tooth extraction, we don't want to give as a anesthesia. We wanted to apply this point. Along with that, you just give as a strong stimulation. That time the patient, without taking any kind of the anesthesia, the tooth extraction to be taken place by the dentist, isn't it? Yeah, half an hour before you just give the stimulation and also activate this point will be really help. Within 30 minutes the patient feel numbness on the oral cavity. Yeah, both the points are advisable. Now, which is the center point of the lobe, that is the eye point, right? Further, you can see there is a lateral side or the outer side, that point to be known as a inner ear related disorders. This point is treatable for the inner ear. You remember somebody is asking, my ears get some kind of the soreness or the pain or the otalgia, otitis media, and further related to the some kind of the otitis media or deafness and deafmutism, anything connected to the interior ear, cochlear related semicircular canals or the vestibular cochlear now get impacted. So that time you remember to activate this point to be known as a inner ear related problem. Do you know there is a middle ear inside of the middle ear to be known as a inner ear? But inner ear, or the reason especially to cause the problem, is the vertigo, giddiness, or maybe imbalances related to the equilibrium related disorders. No doubt cerebellum also important. Along with that, you just add up this point for the inner ear related disorders. We just apply the point over this region. The another region, there is the lower portion. Another two regions are not that great points, will be useful. That is the no identification of the remorse to be given by using that point, but that is the null. That means is no specific region to treat for some conditions, but generally you wanted to apply, you can apply some needles over that region, otherwise withdraw. Now the mostly 1 2 3 4 5 6 out of 9 region, the another 6 point we selected, but one more point also good point for the tooth extraction, but only you remember tooth extraction is the first point, and then the third point is good. Then the just below to this you wanted to apply the another tooth extraction or the tooth anesthesia related disorders, you just apply this point as well. Make sure on the back side of the lobe the needle has not come outside of the ear lobe, so that's very important. In that way you just activate, this will be really helpful to treat for the, what are the indications? Please come on guys, you just tell me what are the problems can be treatable by activating these other points. The central point, yes.
Below is tonsil.
Below is tonsils.
Good.
And the medial side is tooth extraction.
Yes.
And left side is inner ear.
Yes. So in that way, this will be really helpful for the overall below the head region, or maybe it is related to the head region related conditions. Normally can be advisable by using activating these other points. Now